It gives me immense pleasure to invite Srimati Anupriya Patel, Hon'ble Minister of State for Health and Family Welfare, to deliver the keynote address. Her steadfast focus on strengthening primary health care, empowering women and children, and driving inclusive health policies has been instrumental in furthering the vision of Swasth Bharat. We are honored to have her with us today to deliver the keynote address at the NDTV India Health Mission Summit. Ma'am, may I now request you to join the stage.
Good morning, Namaskar. Ms. Vaishali Sood, Senior Managing Editor, NDTV. Shri Akhilesh Sharma, Senior Executive Editor, NDTV. Ms. Sikta Deo, Ms. Vasudha Venugopal, Ms. Gargi Rawat, and all the eminent guests and participants. It gives me both pleasure and a sense of privilege to join you all for NDTV India Health Mission, a platform that brings together policymakers, healthcare experts, and change makers, all of us together, to think about the future of India's health. And by 2047, when India completes 100 years of its independence, it's time for us to ask ourselves, what should the health of the nation look like? And more importantly, how do we get there? Friends, as a government, when we look towards 2047, we envision the health of a country as a system which is resilient, which is inclusive, and which is technology-driven, so that it guarantees access to quality as well as affordable health care for all our citizens. And Government of India, Ministry of Health and Family Welfare has already started marching in that direction. Our government took over in the year 2014, and the first thing that we did was to come up with a new national health policy, which was finalized after 3 years of wide consultation exercise. And this new national health policy differs from its predecessor by focusing on a very comprehensive and integrated model of health, which encompasses preventive, promotive, curative, rehabilitative, and palliative aspects of healthcare. So while the earlier policies only focused on disease prevention, disease control, this policy has a much broader scope, and it makes a complete paradigm shift from the earlier policies that were in operation in the country. And the focus of the policy today in India is universal health coverage. And you would agree with me if I say that universal health coverage is a journey. It's an ongoing work. In India, we are moving fast in the direction of attaining universal health coverage. We have challenges, but we also have achievements. But what I can assure you today is that when it comes to universal health coverage, there is both a strong political will as well as an enhanced public healthcare spending. We are trying to strengthen primary, secondary, and tertiary healthcare in India. So when I say primary healthcare, 1,77,000 Ayushman Arogya Mandirs, which we have in different corners of the country and which have become the first point of contact for any ordinary citizen. Today, they are transforming the way primary healthcare services are delivered by offering a package of 12 different services. So going beyond the traditional maternal and child health services which were being provided at these primary health centers, the Ayushman Arogya Mandirs are providing care for NCDs, for mental health, for eye health, for oral health, ENT, first level emergency and trauma care, and also teleconsultation services. We all know that there is a growing burden of non-communicable diseases in the country. And recognizing this burden, Ayushman Arogya Mandirs are today playing an extremely crucial role in their prevention, detection, treatment, and management. Why I say this is because every individual in the country who is aged 30 years and above is today being screened for diabetes, for hypertension, and for 3 types of common cancer: oral, breast, and cervix. And another noteworthy aspect of these Ayushman Arogya Mandirs is that it is providing counseling services for mental issues. Depression, anxiety, stress, all these are very common. Every second individual you meet has some of the other issues. And there is so much of stigma attached to mental disorders or mental issues that people do not want to seek medical help. So at such a grassroots level, Ayushman Arogya Mandirs are making that early intervention and also helping us to reduce the stigma that surrounds mental issues in this country even today. And because these Ayushman Arogya Mandir, as I said before, provide first level of emergency and trauma care, they are also able to reduce the burden that we have in our country on the tertiary healthcare facilities. Ladies and gentlemen, the future of health in India is preventive. And we have that in our national health policy. But how do we take preventive health care to grassroots level? Here also the Ayushman Arogya Mandirs are playing a very important role. How? Because Ayushman Arogya Mandirs are today educating the community and creating awareness among the grassroots levels, community which resides at this level. What is a healthy lifestyle? Awareness about nutrition, hygiene, sanitation. There are yoga and wellness sessions which are being conducted at the Ayushman Arogya Mandir. So we are making an intervention right there so that people move towards preventive health. And one of the key programs in the direction of preventive health in India is the Universal Immunization Program, which happens to be one of the largest in the world, where we vaccinate 2.6 crore newborns and 2.9 crore pregnant women every year. And when we try to prevent diseases through vaccination, we are not just trying to reduce the financial burden on individual and healthcare systems, but we are also advancing long-term health benefits. And I'm very happy to say that we have not just added 6 new vaccines to our UIP, but we have also been able to enhance the full immunization coverage in India to more than 94%. Ladies and gentlemen, we've also made use of latest technology to attain the success of UIP. Government of India launched the UWIN portal to ensure that every vaccination session is being tracked and monitored, and no pregnant woman who's eligible, no eligible newborn is being left out. That is the way we are working. And when it comes to preventive health care, it is not just the Ministry of Health and Family Welfare which is working towards this goal. There are other programs which were launched in the 11 years of our government, whether it was Jal Jeevan Mission, providing clean drinking water to the common citizens, Ujjwala Yojana, clean cooking fuel, constructing millions of toilets under Swachh Bharat mission, and movements like the Fit India movement, Eat Right India, and now Stop Obesity. These are all efforts which are taking us forward in the direction of preventive health. And that is the way to go if we want to attain universal health coverage. It is also important to pay attention to affordable health care. As I said before, we envision India in 2047 where every citizen has access to quality as well as affordable health care. And when I say affordable, the biggest initiative in this direction has been Pradhan Mantri Jan Arogya Yojana. This is one of the largest health assurance schemes in the world, which provides a 5 lakh rupee health cover to not just the bottom 40% population, but also 4.5 crore senior citizens, also 37 lakh frontline health workers, Asha Anganwadi, and now we've even decided to include 1 crore gig workers. It's a huge scheme benefiting a large section of our population today. And you would be happy to know that this scheme, when it was launched, the intent was to bring down the out-of-pocket expenses. But as on today, 9.5 crore hospital admissions under this scheme worth 1,33,000 crore rupees have been authorized since the inception of Ayushman Bharat PMJ. And not just Ayushman Bharat PMJ, there have been initiatives like the Pradhan Mantri Jan Aushadhi Pariyojana, the Amrit pharmacies, the free drugs and diagnostic initiatives, Pradhan Mantri National Dialysis Program, and many such programs which have all collectively contributed to bringing down the out-of-pocket expenses. And I say it very proudly that in 11 years of our government, we've been able to bring down out-of-pocket expenses from 63% to 39% today. And not just this, we've been able to increase the share of government health expenditure as part of the total health expenditure from 29% to 48%. You may recall the Economic Survey 2024-25, which was tabled in the Parliament. It clearly said that the reduction in the out-of-pocket expenses goes hand in hand with the increase in the public health spending, and it is a step towards attaining universal health coverage. Moving forward, we also envision India in 2047, where there is no lack of availability of specialist doctors. So doctor population ratio no longer remains an issue of discussion. So what do we need to do? We need more skilled workforce. And for that, there has been a huge expansion of medical education in the country. In the 11 years of our government, we have increased the number of medical colleges by 101%. 157 new medical colleges have been built, and now we are even building nursing colleges in co-location with the new medical colleges that have come up. So from 387, we are 780 now in just 11 years. The MBBS seats have gone up by 130%. PG seats have gone up by 138%. And this is the third tenure of our government. And we have promised to this nation that another 75,000 MBBS and PG seats would be added in the third tenure over the duration of 5 years. Friends, it also becomes important today that we make use of digital health and innovative technologies. They prove to be great game changers because they are not just improving the healthcare delivery, but they are also impacting positively the patient care outcomes. And initiatives of the Ministry of Health and Family Welfare, like Ayushman Bharat Digital Mission, which is an effort to create a digital health ecosystem wherein we are providing a unique ID to every citizen in this country. E-Sanjeevani, E-Rakt Kosh, Telemanas, UWin, CoWin. These are all examples of adoption of the latest technology, which is very important. And going beyond, now we are even making use of medical drones, which is the biggest transformative step because they ensure timely access to essential medical supplies, drugs, medicines, samples, everything on time in the most remote and hard-to-reach terrains. And we all know of the diversity. We all know about the geographical challenges of this country. Just last year, on the 9th Ayurveda Day, Prime Minister Narendra Modi ji he launched the medical drone services and 11 All India Institute of Medical Sciences. We're also moving ahead with schemes like MedTech Mitra and Patent Mitra, wherein we try to handhold the innovators, give them regulatory guidance, give them clinical validation services, patenting support, and we make sure that a robust ecosystem is created where their ideas could be turned into market-ready solutions. So all these are efforts which are being made in the direction of more and more adoption of digital technology and innovation. And how can I forget artificial intelligence today? 3 centers of excellence have been set up at All India Institute of Medical Science. All India Institute of Medical Science at New Delhi, at Rishikesh, and also PGI Chandigarh. And it is intended to promote the development and use of the AI-based healthcare solutions. And we've already started using them in the TB elimination program, in eSanjeevani. We are making use of the AI-based healthcare solutions. So that's how India is moving ahead. We want science to help individuals. We want technology to bring equity. And when we look at the size of our country, when we look at the huge numbers we have, 1.4 billion, the scale is huge. The levels of disparity are unimaginable. So in such a situation, when we think of the ambition of universal health coverage, public-private partnership becomes very important. The convergence of the public sector intent and the private sector capacities, it's not only desirable, but it also becomes indispensable. And there are so many opportunities that exist for us to converge. There are schemes like Ayushman Bharat PMJ. Now what we need is more and more private hospitals for empanelments. There are opportunities in expansion of medical education, diagnostic services, medtech parks, healthcare startups, everywhere where private sector can come and participate. And even the national health policy talks about the key role that this partnership can play. So I'm only here to appeal to you and to everyone that health is a shared mission. And when we envision the health of the country as resilient, as equitable, as technology-driven by 2047, it becomes everybody's responsibility, whether it is policy makers or it is healthcare change leaders, change makers. It is healthcare practitioners. It is just everybody who has to come together. So all I want to say is, this is a government in which health is no longer on the margins. Health is not a fringe issue anymore. Health is the priority of our government. And in 11 years of Modi government, health has returned to its rightful place as the cornerstone of nation's development and social equity. So let us all collectively march towards achieving universal health coverage and building a stronger and a healthier India by 2047. With this, I conclude my remarks, and I thank NDTV for giving me this opportunity to share Government of India's perspectives on health and what kind of India we want to see in 2047. Thank you all for being patient. Jai Hind.